Bringing a baby into the world is one of the most incredible experiences in life. But if you're expecting, you've probably heard the big question: C-section or vaginal delivery? Which one is safer? Which one is less painful? And what's better for you and your baby? Stick around because today, we'll break down the pros and cons of both, what to expect, and the key factors to consider. First, let's understand how each type of birth actually happens. In vaginal delivery, what happens is the uterus contracts, the cervix opens, and the baby moves through the birth canal. For first-time moms, it takes about 12-24 hours. And for experienced moms, usually it is shorter. In vaginal delivery, the pain is more, but manageable with pain relief options like epidurals. In C-section, a surgeon makes an incision in the abdomen and uterus to deliver the baby. It usually takes 30-60 minutes, but maybe less or more depending on the situation. The pain level is minimal during surgery, and that is due to anesthesia, but recovery can be painful. Alright, let's compare the pros and cons of each. The benefits of vaginal delivery are faster recovery, which is usually a few days. There is a lower risk of surgical complications. And it helps with the baby's immune system. Also, there is a lower risk of breathing problems for the baby. The problems that we face during vaginal delivery are the pain during labor and delivery. There is a risk of vaginal tears or needing stitches. Also, labor can be unpredictable, which means it can be long or complicated. The benefits of C-section are predictable and scheduled, which reduces the last-minute stress. It is useful for complicated pregnancies, like breech presentation, twins, or medical conditions. No tearing or trauma like in vaginal delivery. The drawbacks of C-section are, it can take a longer recovery time, like 4 to 6 weeks. There is a higher risk of infection, blood loss, and complications compared to vaginal delivery. C-section babies might have temporary breathing issues. Sometimes, a C-section isn't a choice, it's a necessity. Here are some situations where doctors recommend it. When the baby is in breech position, which means the feet come first instead of head. Placenta previa, that is when placenta blocking the cervix. Umbilical cord problems might end up in a cesarean section. C-section is a must if the baby's heart rate drops dangerously. In some cases, previous C-section is an indication. Let's be real. Pain and recovery matters. During vaginal birth recovery, pain present mainly during labor. The recovery can take a few days to a week. There will be some soreness, but walking and moving are easier. During recovery of C-section, the pain starts after surgery as anesthesia wears off. Also, the recovery takes 4-6 weeks. You need to avoid heavy lifting or intense activities. So, which is safer? Statistically, vaginal birth is generally considered safer for both mom and baby in most cases. However, C-sections are life-saving in high-risk situations. Don't forget, always consult with your doctor to decide what's best for you and your baby. So, how do you decide? Consider these factors: your health condition, your baby's position in the womb, previous birth experience, and of course, your doctor's recommendation. Both C-section and vaginal birth bring beautiful babies into the world. The most important thing is a safe and healthy delivery. So, whether you go for a natural birth or a C-section, remember, you're bringing life into this world, and that's amazing. Please don't forget to like, share, and subscribe for more health tips.